Hi, everyone, and welcome to the next episode of Welln'ish. I'm really excited about our guest today. We have Liane Cubellis, who's a who's a pelvic floor physiotherapist in the Montreal area. So welcome.
Thank you so much. I have to tell you, I've been so excited to have this podcast with you. And I feel like the listeners are really in for a special treat because we've put out these ideas and interesting topics of conversation, especially in the first half, that I feel are going to be so relatable to many of the audience, whether it's like old, young, men, women, you know, athletes or personal trainers, nurses, healthcare providers, and so on. So I just wanted to put it out there that I feel like the listeners are going to be in for something really, really nice today.
Yeah, I feel the same way. Like we collaborated on these questions for those of you who don't know the inside scoop, but we've really tried to get some questions that aren't necessarily always answered on whether that's social media or things that are talked about less. So should be good. So I wanted to jump right in. So can you explain the different types of pelvic floor dysfunction? So we often hear it's tight, it's weak. Can you explain what that means and if there's a possibility that these can come in combinations?
Yeah, for sure. Riley, real quick, I'm going to go straight into that. But for those who don't know me, I did want to maybe give them a bit of an overview of like what I do, if that's okay.
Yeah, perfect.
So for those who are tuning in for the first time, I am a physiotherapist, of course, and I have expertise in pelvic health. That's my area that I am most passionate about and that I choose to work in, the private sector. We don't have many resources yet for the public sector, but we're really hoping that will change in a bit of time. And so with that being said, yeah, we can jump right into it. We're ready.
Actually, no, I'll just going to bounce off of that. So
Sure.
What kind of education did you have to do to become a physiotherapist who specializes in pelvic floor therapy? Just because I know some people haven't listened to our first episode where we kind of touched on that.
So I'll make it very simple. Once you graduate in physiotherapy, you can really choose to become specialized in areas that are interesting for you. It could be concussions. It could be, the TMJ, it could be in sports injuries, and I chose pelvic health. So it's an add-on after, the master curriculum at the university. Okay. And then you sort of choose again, and pelvic health is a really broad category as well. You can choose to specialize in different areas in pelvic health. It could be pre-postnatal, geriatric, pediatric. It could be in oncology. Okay. I can go on. Okay. So I did the micro-programme at Université de Montréal and alongside some other courses from Eurosanté and different areas across the US and whatever, even across Canada and in Europe as well. There's so many courses accessible now, which is really nice for us.
That's great. Mm-hmm. Okay. So on to pelvic floor dysfunction. So
for sure.
I'll just repeat it.
Yeah.
Can you explain the different types of dysfunction that exist? We hear tight and weak mentioned a lot, but can there also be combinations of that?
Absolutely. So pelvic health physiotherapists are specialized in assessing and treating pelvic floor dysfunctions. And what that means is that the muscle, I'll make it very simple. It could either be, too tight and sort of in spasm or tense, or it could be overstretched and lengthened. We call that a hypotonic muscle. And so if you're, either one or the other, that could lead to symptoms and having dysfunction. So for example, if someone would have a muscle that is more lengthened and overstretched, that could lead to something like urinary incontinence, fecal incontinence, pelvic organ prolapse, where the organs are sort of sitting lower down in the vaginal canal. What else? So there's, for men, erectile dysfunction as well. But contrary, if the muscles are, too tight and tense, that could lead to symptoms. For example, we'll see things more like urinary urgency and frequency. It could be hesitation or difficulty voiding, constipation, anal fissures, hemorrhoids. We're looking at also having more congestion like around the organs. And that could lead to something, for example, like interstitial cystitis or more persistent bladder syndrome, which is maybe a better, use of the diagnosis. And for men, that could look like a prostatitis or just chronic pelvic pain syndrome in general. It could be painful intercourse, otherwise known as dyspareunia, which just means pain with sex. It could be more specific, like having pain at the entrance, or more global, which we call more like a vulvodynia. So that would be something that we would see more with like a hypertonic, so tight muscles. And I just want to make sure I'm not missing anything. Other than that, you can expect also pelvic floor physiotherapists to treat, for example, the pudendal nerve, which is the nerve that innervates the pelvic floor muscles and area, pelvic cancer. So anywhere from, vulvar, cervical, uterine, ovarian, colorectal, bladder, prostate cancer. We definitely do like pre and post checkups for that. We treat scars, C-sections, episiotomies, vaginal scars, just like any other scar in the body. It's so important. We look at the internal unit diastasis, which we're going to dive into today. And then, of course, like the low back and like, pubic symphysis and sacroiliac. So real quick, I know that was a lot. But I wanted to give the audience an overview of like the variations that we see in clinic, because I feel like people are always like, oh, you just do incontinence, or you just see moms after they have a baby. And truthfully, we can see so much above and beyond that. And my clientele is very vast, and I do see all genders and all sorts of things. Right.
Well, that's so important to touch on, is that it does exist for men as well. And that is not spoken about often at all.
Absolutely. Yes.
So what are some risk factors for pelvic floor dysfunction for men and women?
Sure. Why don't we start with women? So I prepared you this grid that summarizes in 3 different sections. So the first one is like the general sort of population of women. Then we have pregnancy related, and then delivery related. So the first one being general, we're looking at, for example, someone who's frequently constipated, chronic constipation, or like having to bear down and push often. Again, someone whose occupation or in their day-to-day, they're having this high intense physical activity where they're not managing pressure and they're having to force or bear down frequently throughout the day. There's also people who are like more asthmatic and tend to cough throughout the day. Menopause, certainly, and age have an impact because of the hormonal changes over time. And, the estrogen levels go down, which really impacts the collagen and the elasticity of the tissues, which can increase symptoms. There's overweight, obesity, certainly some genetic and hereditary factors, as well as like race and ethnicity definitely play a little bit of a role here. And then pregnancy and the number of deliveries. Now, if we're looking at women who are pregnant, we would, for example, consider the hormonal changes and the postural changes in them, which could certainly impact their pelvic floor. And this includes women who get a C-section, just for the record. Because
absolutely.
Right? Yeah. And then women who are having a vaginal birth, the risk factors that we're looking at for them that would lead to more trauma would include, the weight of the baby over 8 pounds, the circumference of the head being over 35 centimeters, the time that they're pushing, if it's over 2 hours, and of course, the use of instruments like the forceps and the suction. And am I leaving anything out? That's pretty much, those are like the most important things that we're looking at when they come postpartum that would really impact their pelvic floor.
Makes sense.
Yeah, I would say for men, because we asked for both men and women. Yeah. All right. So for men, their pelvis is a little bit more narrow than women. And if they have weakness in their pelvic floor, the muscles are overstretched, they're not as impacted as women are. But they can be, certainly. And we can address that. They can have some incontinence as well, like fecal or urinary. However, I would say most of the men who come for a consultation tend to be overactive. And they tend to be people who clench without really knowing. It's involuntary, and it could be, as a means of compensation or a response to stress, right? And so the risk factors, I'm like not sure exactly what that would look like, but certainly just clenching and compensating, and maybe even like the sport of their choice. For example, a cyclist who's on the saddle for a long period of time, that could lead to like weakness and numbing, tingling, burning, and all that stuff.
Yeah, I could think also of weightlifting.
Yes,
creating some major
definitely.
weakness. Like I remember when I used
Oh,
to do CrossFit, we would like take our belts and make them as tight as possible. And, you know, you're bouncing out of your squat too, which like, then I started learning about the pelvic floor and I was like, wow, what were we doing?
I love that you mentioned that. It's interesting because for men, you know, the pressure in the abdomen is always going to choose its path of least resistance. For women, we have
Mm.
an open vagina and we might have a weaker core postpartum. So our path of least resistance is going to be our core and our pelvic floor. For
Mm-hmm.
men, that might not be their path of least resistance. It could look like a hernia, an inguinal
Mm-hmm.
hernia, an abdominal hernia, could look like a disc herniation. So when
Makes
their
sense.
posture and alignment is not aligned and not
Mm-hmm.
optimal, you know, they might not feel symptoms. They can feel symptoms in their pelvic floor, but it could look like a different presentation for men, you
Mm-hmm.
know?
Oh, yeah, absolutely. That makes so much sense because hernias, for example, are more common in men, right?
Yeah, they do have an anatomical or sort of congenital prevalence there in the spermatic cord. There is a
Mm-hmm.
weakness where those structures come out, so they are more susceptible in general. And I believe it affects 25% of men, so 1 in 4. So it is quite
Okay.
prevalent
That's
in
very high.
men. It is high. It is high. Yeah. Yeah. And
Okay.
certainly much higher in athletes and especially CrossFitters for sure.
Yeah. We should just give out our cards there. Um, so you may have already touched on this, but in case it leads you to think of anything else, how do people end up with pelvic floor dysfunction? Like, are there any more daily habits that you see that are common that increase dysfunction? Like,
Right. I think that's a nice question, you know, because we often just look at the pelvic floor in itself, which can develop weakness or tightness based on some of the things that we spoke about, like bearing down and pushing and deliveries and compensations, or like tightening too much throughout the day. But I think something to consider aside from that and sort of the bigger picture is what is happening in the core system and in that internal unit, and how is that pressure system working for you and impacting your pelvic floor? Because ultimately,
okay.
I can have someone who's leaking, for example, and who has pretty good strength and endurance of their pelvic floor, but their breathing is not right. And they're just sort of
Hmm.
bulging when they're not supposed to be. And that could result into leaking, right? So I feel like we're so caught up in the pelvic floor, but we have to look at the bigger picture.
Mm-hmm.
So like breath holding or not breathing properly, like a lot of people breathe opposite when they're training, or,
Yeah.
you know, alignment and posture. So when their ribs are flared, you know, out, or their ribs are flared down, that could look like an
Mm-hmm.
upper sort of ab gripper, and they're going to be
Yeah.
bulging pressure down, pooching in that lower belly and down in their
Okay.
pelvic floor. You know what I mean?
Okay. Yeah, absolutely. I mean,
Yeah,
that's a pretty good transition into the next section.
sure.
Can you explain the relationship between the pelvic floor and core muscles?
Of course. So our pelvic floor is actually very much a part of our core. And when we think of core, we often think of just the abdominal muscles. But in reality, there's really 4 muscles that work in synergy and even in harmony together. So our pelvic floor, you know, parallel to that on the top, we will find our diaphragm muscle, which is quite large and sits really in this, like in the rib cage, and is an upside down dome on top of our pelvic floor muscles. And these 2 muscles need to work in harmony together. So for those who are watching the video, I'm doing the gesture with my hands where the pelvic floor and the diaphragm need to be working together. And these muscles also work synergistically with our deep abdominal muscles that we call the transversus abdominis. And they also
Mhm.
work with the multifidus, which is a muscle that runs along the back of the spine, which is important, but not so much when discussing that like intra-abdominal pressure. So
Right.
these 4 muscles work together to stabilize the spine and pelvis, which is one of the functions and roles of our pelvic floor muscles. And of course, as we mentioned before, they also help manage what we call that intra-abdominal pressure. It's also
Okay.
important, I would say, to mention that these muscles are anticipatory muscles, which means that they work, you know, in anticipation of exerting like an effort, you know, so they all have to work collectively together and properly to support our spine and pelvis and manage that pressure before enduring an effort. Does that make sense?
Absolutely. Yeah.
Yeah. I actually have an
Um,
image for those who are watching the video. I'll show it real quick. It's this. So we have our diaphragm up here, the pelvic floor, our deep abdominal muscles, and the multifidus in the back. And these all manage pressure inside that abdominal canister.
So what are some factors that can negatively affect our abdominal pressure, and why would that be important? Like, even I'm just thinking about that image. Let's say the person has a big lordosis or has none. Like, those are some examples that I can think of, but can you explain a little bit more any other factors that may be affecting someone's intra-abdominal pressure?
Right. I think we had touched up on them or some of them earlier, but essentially, yes, the alignment definitely is so important because we need our ribs to be really stacked on the pelvis. If our ribs are thrusted out, as you mentioned, increasing lordosis or having that pelvis tilt forward. Well, I'll show you in the video, but this is what it would sort of look like, where the muscles in my back are tightening. These muscles are now stretched and elongated, and there's definitely more pressure going down into my bladder. And this could definitely result more into leaking. So with that being said, when these muscles don't collectively work together and there's one taking more load than the other, that's often when we lead to injury, right? Okay. So if the abdominal muscles are overstretched and weak, that could be one of the reasons why we're more in the lordosis, where the back is arched. And I could almost promise you that that person is also having pain in their lower back because those back muscles are always so tight and having to work so hard to provide the work that the other muscles are maybe not doing, right?
That makes sense.
If
Absolutely.
someone is in the opposite, where they're sort of clenching like their bum and their pelvis is down, we might see more tightness in the back end of their pelvic floor. And you might see some like bulging going down in the lower belly. So that can also mismanage the pressure system as well. And they would typically have flatter glutes as well because their glute muscles are more inhibited. And so there's like less movement and range of motion anyway. So either way.
Is that something that's common postpartum? Like that posterior postural tendency?
Well, we'll notice in pregnant women, especially in their last trimester, they tend to waddle and they tend to rotate their feet sort of outwards, which kind of looks like this. And so by adopting that waddling position, it certainly puts their glutes at a disadvantage and shortens and atrophies the muscle. And this is why a lot of moms lose that booty postpartum, right? And they're like, what happened?
Makes sense. Yeah. So how can people start creating that connection between their core and pelvic floor? Are there any kind of general exercises or awareness exercises that people can start adding to their daily routine?
For sure. I think it's important initially to keep the exercise super basic and start with just breathing, being mindful of where the diaphragm is going and connecting with the pelvic floor. So I often start with this core breath, which is really built to build those neural pathways from our brain to the muscles, and takes a lot of practice and repetition to have that feel more natural and intuitive, right? So like anything else, you're sort of building this habit and this natural way of connecting our breath to our pelvic floor and our deep core abdominal muscles as well. Once we start with this exercise, then we could add on some loading strategies, whether it be on our back, on our side, on all fours, or in standing. And we can keep the exercise very basic, like a squat. And I love this squat because truthfully, we do it 10,000 times a day when we're getting out of bed, when we're getting out of our car, when we're getting out of our chair, when we're sitting down for lunch, right? So we start with very simple functional movements, but our goal is to understand what the goals and needs are. So for you, for example, to go to CrossFit, we really want to be able to integrate this core breath or this piston way of breathing, this piston breath into the movement that you're doing. So to go back to the basics, we start with a simple exercise. We progress it slowly until it becomes more intuitive and natural. And then we integrate those strategies and concepts into something that's maybe more intense and difficult in order to reach your goal, which could look like running a marathon. It could look like jumping on a trampoline. It could look like, performing your sport, going back to CrossFit, or just walking around the block.
Right. And when you're taking, let's say, a deep breath in, what are some cues that people can do or try to feel for in terms of their abs? Like what do they want to feel when I remember the first time I went to a pelvic floor therapist, I was like, I have really good core awareness. She's like, you're literally just clenching your rectus. I was like, oh, okay. Like I had no clue how to like really engage my transverse. So would you have any practical cues for that or things that people can think about?
For sure. So I would start in a resting position. That's like the most simple way to really connect to the internal unit. And as you inhale, you really want to expand, not just in your belly, but you want a 360 rib expansion around those lower ribs and minimize air coming in to the top of your chest.
Okay.
Because that would be a sort of compensation. So when we talk about inhaling, for those who get kind of mixed up or confused, do the movement with your hands. Imagine the air coming into your mouth and filling down into your lungs. The diaphragm is actually moving downward to allow the lungs to expand. So when this comes down, you want to create space in your abdomen and in your pelvic floor. So you should feel your belly expanding and your muscles and the pelvic floor lengthening down and out. Mm-hmm. And this is really difficult for men and women to understand, that the muscles are able to lengthen down and out. And you will literally feel like your tailbone is moving away from your pubic bone, or like your ischial bones, or right, the bones that we sit on are sort of floating away from each other. Mm-hmm. This is a very difficult exercise to get that like full range of motion and flexibility. So then on the exhalation, what you would want to do is like you're zipping your jeans from the bottom up. Right? So you want to start by contracting your pelvic floor by squeezing the vagina and the anus. Mm-hmm. Then using your lower abs to engage, so bring your belly towards your spine. And then exhaling, bringing the air back out of your mouth. So to summarize, inhale, open, expand in your belly and pelvic floor. And then exhale, contract your pelvic floor, engage your deep core muscles as you exhale. Does that make sense?
Absolutely. It's just not easy.
No, it's not. And I think it's interesting because a lot of patients who come find this exercise really counterintuitive. Mm-hmm. And they're almost like, but wait, that's not how you're supposed to do it. They inhale and they squeeze and they do this motion with their shoulders where they lift them up, right?
Yeah.
And I often say like, well, that's why you're here.
Yeah.
Because if that felt so intuitive and if that was natural for you, you probably wouldn't have symptoms. Mm-hmm. You know what I mean? So if you're finding this particularly difficult and you're having a hard time, you know, by coordinating these muscles together, mm-hmm. then we could most likely help with your symptoms, you know?
Absolutely. And then, then this brings me to my next point is, you know, why is it important for somebody to see a pelvic floor therapist to see if their pelvic floor is really working with their breath? Because there's only so many biofeedback cues you can give yourself, especially when, I don't want to say the wrong, but like you've been breathing poorly, or you haven't been having that nice dynamic between the diaphragm, transverse, and pelvic floor.
Right. Well, a lot of people, you know, for example, training in a gym are not going to have this perfect breath and perfect alignment. And often I see them not even being corrected by their personal trainers, but they're not necessarily vulnerable. And so they're not symptomatic yet, right? So when we're thinking of weakness, this is something that happens with poor habits over a period of time, or it can happen in people who are just more vulnerable. So if you're pregnant and you have this like laxity in your tissues because of the hormones, the relaxin, or even postpartum, mm-hmm. you have to know that your core is not ready to accept that kind of load just yet. Right. And that your pelvic floor is not ready to accept that kind of load. Mm-hmm. So if you're, you know, loading and not mindful of your breath and all that stuff, that's when it becomes dangerous and could lead to more symptoms. Mm-hmm. So I feel like anyone can definitely benefit from breathing better. And if you look, you know, my son, I have 2 kids, by the way. I have 2 boys, they're 6 and 7. Aww. And one of them just started Taekwondo, is like actually loving it. And so I sat with their, you know, one of their first classes. So fun. And so one of the first things that they do is they actually go, ha, and they yell when they're punching or kicking. Right. And they're taught from the age, from like when they're young, to exhale on the exertion, and they, ha. And I actually turned to the master and I said, I find that so nice that you guys implement this breath, with their efforts early on. He looked at me and he's like, breathing is 20% of the fight.
Wow.
If you don't breathe properly, right, you're going to get winded. You don't oxygenate. You're going to get injured. Breathing is so important. And whenever we look at athletes in anything, whether it's tennis, we hear them yelling on TV.
So
whether
true.
It's boxing, that's right?
Yep.
It could be golfing. They're always breathing so well and their posture and alignment is perfect. It is never compromised, right?
Yep.
And their core is really working so well for them. And so, yeah.
Absolutely.
That's it. I forgot what the initial question was, to be honest. We got carried away.
Well, you were, you were just
uh,
commenting on the importance of breath and learning. I was talking about how an internal exam is important because you might be thinking that you're, like a lot of people are, think that how they're intuitively breathing is correct, when in reality, some people are doing the opposite. So having that internal exam with a pelvic floor therapist can really help people understand, if they're actually moving their pelvic floor with their breath or not, or in the right sense, to prevent any dysfunction.
Absolutely. And I feel even someone who wasn't symptomatic, I feel like learning this sort of strategy and breathing in this way will really optimize their performance in whatever they're doing and truly minimize injury in their body. When we look at the piston breath, this was developed actually by one of the physiotherapists in the States who's called Julie Weed, who uses this breath with like really elite athletes, both, primarily women, but essentially this is what she starts. She works in orthopedic. So just on the record, that means like she couldn't treat a shoulder injury or like a hip injury. A knee injury even, and she'll start with the fundamentals. How is your alignment? How is your core and your internal unit? This is the foundation of our body, like the foundation of our house, right? Our windows will keep cracking if our foundation is not solid. And this is really similar when looking at the body. And so we look at, pelvic floor physiotherapists don't just look at the pelvic floor. We look at the internal unit and how that core unit is working for you to help, again, have better posture and better stability to minimize injuries elsewhere in the body.
Absolutely. I did CrossFit for a long time and I ended up with some pretty chronic injuries, and a lot of people that I started with now no longer do it for the same reasons. And like, I think back and I do tell people, I think that there are some gyms who do it well. I think some people do it well. And it's not even just CrossFit, but anything that is load bearing, high intensity, anyone who is an athlete also. And I think back and I'm like, how would it have been better? And it's like, I just wish that there was like some sort of introductory course where everybody has to learn how to use that core, like your core, that intra-abdominal pressure and alignment and everything, all of those like learning how to use your breath and the small muscles, a thing that maintain the integrity of your joints and don't lead to long-term injury. I wish we would just start small. And at the time, you could not tell me anything about longevity. I didn't care when I was in my early 20s, but like, it's so important. And I just wish there was more rehabilitative exercises or like physios who would work in conjunction with gyms so that there was that protection,
Riley, I will say that my background in my bachelor's was in exercise science. This is the kinesiology. It's like an equivalent for those who don't know. And I'm not old by any means. I'm not old at all. But when I did my bachelor's, we didn't talk about the pelvic floor, and we still sort of practiced the Valsalva, which is when you close the glottis and you block your breath to lift heavy. And this has changed. And we have to know that we're, by the way, I have to tell you this, what initially sparked interest in pelvic health from a lot of researchers was a CrossFitter. I feel like it was like, Sarah something? Do you know her?
Sigmund's daughter? Maybe.
She
won a few times.
A YouTube video, but there was a video of a like really high level female athlete like working out at the gym. And she did a movement and had this like leaking situation caught on video that went viral.
I'm sure it was her. Yeah.
Did you know that?
It sounds familiar.
It sparked a lot of interest. Yeah. And it sparked interest to understand like, okay, what is happening here and how could we improve the situation, Well,
I'm pretty open about this.
So there's a lot of...
Oh, sorry, I didn't want to... You can finish your thought.
No, I think that you're right, that there's so much education to be made around this topic, which is why when we had spoken the first time, I'm like, this is something that needs to get out there, because I feel like even, personal trainers and people who want to work out even after having a baby, there's a lack of knowledge in this field. And I continuously have, moms saying like, this doesn't feel right. And they're making me, for example, do planks or exercises, and I feel bulging and I feel like I'm compensating, which leads me to say also in CrossFit, there's this sort of high repetition, this number that you got to get in. And because you're not doing things as slow and controlled, that could leave more room for error and compensation. And the loading becomes really difficult to manage in these situations. So I feel like it's so nice that we're having this conversation, and I'm hoping that this will allow the listeners to, think of how they're breathing and think of how their core is responding, right?
Absolutely. And I love what you said, like when you see people and their breath isn't right, how you're like, you don't have any, or their posture, you don't have any pelvic dysfunction now. And that was exactly what it was for me when I was very into the gym and the CrossFit world. Was I had no issue ever in my life. And then doing Valsalva constantly day after day, catching heavy loads where maybe this is where like the multifits come into question. Obviously that wasn't there. And then eventually, and this was common to almost every girl at the gym, doing box jumps or doing double unders and catching like cleans at the bottom of the squat was lots of leakage. Never had any leakage before that, which is again what started piquing my interest into pelvic floor therapy also. I had, these are all women also who hadn't even had any kids yet. So, and there was videos online amongst the CrossFit. I don't want this to be about hating on CrossFit, but it was just like a video online that was saying, that was equating leaking as being hardcore. You're pushing yourself. Good job. And then I started studying osteo, and it's like, no, you're just ruining the pelvic floor function and making it worse and having terrible habits on your intra-abdominal pressure that are only going to get worse when you have a baby. Like, it was just like, anyway, I think back to that and I'm like, this was actually a video that people were like priding themselves on having leakage when they would train, because it was that they were being hardcore and pushing through.
For sure.
Anyway.
It's interesting with the double unders, because there's certainly a pelvic floor component where we need that muscle or those muscles to really support the sphincters and the organs. However, if we compare different types of double unders and we slow down videos side by side, we'll notice that one of the main drivers of leaking is alignment and posture. And that those who are doing the double under are actually arching their back too much.
Okay.
And their alignment is off, and that's increasing pressure, which is increasing the load on the pelvic floor. So going back to the original, I like how this is all sort of tying in together, because the pelvic floor is a big part of it, but also managing pressure. And this leads me to also say, like, I'll get some women who come back and they say, oh, I've already seen a pelvic floor physiotherapist. They gave me some exercises, but it didn't do anything. And it's like, okay, but aside from the exercises, have you integrated any better strategies in your like day to day? Are you more mindful of how you, engage when you're coughing, sneezing, lifting, carrying, or any of that? They're like, no. And I was like, well, there's missing a huge chunk here, right? Yeah. Like, it's not just about the exercises. There's a maintenance here. And there's also just understanding how your pelvic floor plays a vital role in our core and unit system to sort of, work in conjunction with these other muscles. Because if it's just not doing anything when you're coughing or like picking up something, then it might still lead to dysfunction over time.
Absolutely.
You know what I mean?
Makes so much sense. So just to wrap up our section on pelvic floor dysfunction and the pelvic floor synergy with core, I was wondering if you could reiterate for listeners what some signs and symptoms are for men and then for women that should indicate to them that they should consult. And then we can kind of move on to some perinatal and postpartum for part 2. If that sounds good for you.
Some signs and symptoms. So again, a lot of our work, we try and be more preventative. However, if you are experiencing symptoms of incontinence, whether that's like leaking urine or even fecal incontinence, which is on the rise as well. And if you're feeling any heaviness.
Just to come back to that. So what do you mean by fecal incontinence? Because I know some people...
Loss of gas or stool.
Okay.
Any loss of gas or stool.
So yeah, I just remember seeing some posts on Instagram where it was like, you should never have any markings in your underwear. And I've said that to clients and that was surprising to them. So I just wanted to reiterate that.
Mm-hmm. Right. When the perineum is distended, the sphincters are definitely more relaxed, and that could lead to some soiling situations. If it's getting out of hand or happening very frequently, then that could be something that we look into. However, I wouldn't say it's impossible, because a lot of people do have hemorrhoids or sort of have these like extra skin at the entrance. And sometimes it's a matter of just wiping in between those intricate pieces of skin. You know what I mean? So it doesn't always have to be because of a weakness, but generally if it's happening like often, it would be worth looking into. And that could be an indication that the external anal sphincters may be more lax and it's just sitting more low in the perineum.
Makes sense.
Yeah.
Sorry, I cut you off, but you were...
So no, for sure. Right. So we talked about like having this sort of leaking. If you're having any heaviness or pressure, or sensations of fullness in the lower abdomen or in the vagina, that could be an indication of a prolapse. I mean, those are the most prevalent symptoms, but there's so many other ones. What else? If you're having, so pain is never acceptable with intercourse, ever. I want to make that very clear. You should never be having pain. So if that's something that is happening, definitely go and see why and assess that. Hang on a second. Urgency, frequency. I feel like we spoke a lot about this in the beginning. Like some of the signs and symptoms, right? Like you're always having to pee. Everyone has a friend who's always looking for that toilet.
Yeah, absolutely.
Who's like, oh my gosh, I got to go every hour. That's a problem. That could be an overactive bladder or again, some like tightness in some areas that we want to address.
And then
those are like the main points.
And then for men, are you able to help with things like with the prostate or erectile dysfunction or anything specific that we did mention?
Yeah, it's quite similar in women. I think when the muscles are tense and overly tight and that there's that congestion, it can certainly affect the prostate and affect the blood flow going to the penis and thereby affecting their erection. And so we have to think of the muscles being able to work as a muscle that could work through its full range of motion. Think of a bicep, those men who want to go out and they do like their push-ups right before moving and they get that muscle pump, right? They get that like surge of blood flow because they're really pumping that blood flow into their muscle by doing these full ranges of motion. Well, think of that same person being limited and their muscles tight or overstretched and weak, and they're just working at 30% capacity.
Makes sense.
They're not engaging as much blood flow into the area. So their muscle's not functional. And that's when we call it dysfunctional muscle. That's where the word comes from. It is a dysfunctional muscle because it's not working to its full potential. So with that being said, it certainly can affect the erection. But, aside from that, I do want to say that there's like testosterone hormones, libido, and like many other factors to sort of consider and take into consideration.
And what about
so for
a
men,
couple, having issues with fertility? Are you able to help have an effect on sperm quality and mobility and motility?
Ooh, good question. So as far as I know, up until now, I can't say for sure. Okay. I'm not sure. I'm going to leave that open. Yeah. I don't know what the latest like studies and literature would recommend for that. I'm not sure how that would impact their fertility for men. Yeah.
All right. Any last thoughts or anything else you want to share about pelvic floor dysfunction before we move on?
Yeah, I'm not sure I answered the question about men very well. I think men who experience some symptoms it could look like pain that is referred in the genitalia. So it could be anywhere at the base of the penis, at the tip as well, into the scrotum, or even into the anus. It could look like tingling, pins and needles, burning. It could be pain after ejaculation, for example, or after an erection or during an erection as well, which is more rare, but can happen. And then aside from that, there's also like hesitancy where they're having difficulty voiding. It could be because their prostate is enlarged, but it could also be because their muscles are tight and restricting the urethra. So that's up to us to sort of see upon the assessment what our findings are and see if there's anything that we could do to help them. And again, we talked about like that prostate cancer and having that radical prostatectomy. This would be a big reason for consultation in men or other gynecological, oncology reasons.
Okay.
like if it affected they had radiation to their bowels or, like a neo bladder, things like that we also see for men.
Absolutely.
I hope I didn't forget anything because I feel like we don't talk about them
I
enough,
know.
but I also feel like it's important to share that they have pelvic floor muscles just as we do, and they get affected very much
Yeah.
the same way that we do,
If you're a man and you're dealing
Yeah.
with anything in that area, that you're having question marks about, I'm almost positive that a pelvic floor therapist will have an approach or at least, an idea of something that they could work on to potentially help.
Yeah, I think men, just like women, a lot of them just don't have that awareness and don't know how to connect with these muscles and didn't even know that they had muscles there. They had no idea. And so when you cue them like, oh, yeah. So when you give them cues, they're like, wait, what is that? And then it's like, well, think about when you go to the bathroom, how do you, for example, pass stool or gas? And then, okay, let me try. And then they kind of get it. So I think for women, there is something to be learned there that they have muscles that they're able to connect with. And it can only help. It certainly can make it worse. Yeah. My pleasure. Sounds good. We'll see you in part 2. Have a good day. Thank you so much for having me. I was so excited today to talk about this stuff. So I hope that the listeners appreciate and can learn something. Amazing. Me too. See you soon.